there's a huge gap between the perception of professionals and perception of patients. I wouldn't imagine a patient saying after an intervention, entering into the into the office doctor saying, "This new tablet has provided me a reduction of 30% of risk of readmission, and I feel much better because of this." We use instruments; they are validated, but still the information you get is very limited. We've been talking about patient-centric medicine for a long time, but still using the questions from a medical-centered system, right? Probably we need to ask other disciplines and other experts, maybe anthropologists, maybe sociologists, I don't know, in order to make the right question. A piece of pie actually opened my eyes in terms of having a different look to the way I usually get information about how the disease impacts patients with chronic heart failure in my case. When you think about medical anthropology, somehow I thought it was more or less the same that the usual qualitative research I've seen doing nursing. But then when I really went on a journey together with Piece of Pie, that I discovered it was not exactly the same. Actually, this was covering a huge gap we had using previous methodologies. There are scientists with particular sensitivity for knowing what's actually the real limitations that the patient experiences in terms of chronic conditions or other diseases. So this particular sensitivity in terms of gathering information that you otherwise wouldn't get from other means is what, from my point of view, would define a Piece of Pie as a group. The point of view of the patient will give us insights in terms of how to design better interventions. I could be, I don't know, any company and design a wonderful tablet that may change, let's say, the evolution of heart failure, or maybe the evolution of chronic pain. But if I don't really understand how patients live the process of care, I hardly would be able to identify when my drug would be able to be prescribed and would be actually effective. Medical anthropology brings you a new point of view.